Childhood disorders are extremely important, and what you need to understand is that most of them are going to be diagnosed more frequently in boys than they are in girls. The first one of these disorders will be mental retardation. What is essential about mental retardation for you is that you understand what the different types of mental retardation will be, what it is that each one of these have the ability to do, therefore, what is their level of functioning. So mental retardation, the basic definition is that you need to have an IQ under the age of 70. So anyone who has an IQ under 70 will have a diagnosis of mental retardation, but the IQ alone is not sufficient. For you to have a diagnosis of mental retardation, you also have to have what are called social adaptive deficits. So these are children who are born, and most of them, because they're mildly retarded, they're not detectable at birth. Because they're mildly retarded, most of them reach their milestones just like all the other children. Because they're mildly retarded, you also go to grade school and people still are not aware that you're mildly retarded. However, as you start to get older, you start to have problems adapting to the demands of life. You have problems adapting to school. You have problems adapting to home. You have problems interacting with teachers, with peers, with your family, and these are what the deficits that are essential in the diagnosis of mental retardation will be. So when you have the IQ under 70 and social adaptive functioning deficits, that is what makes the diagnosis of mental retardation. And of course, for you to have this diagnosis, it's important that you must be under the age of 18. Now, they really do not know what causes mental retardation. Is it something that is genetic? Is it something that happened to the mother? Is it something that happened after you were born? So there's numerous reasons why these disorders can occur. The number one cause of mental retardation overall, of course, will be the fetal alcohol syndrome. So these are women who drink, their children are born with certain deficits. If you have the mother who, let's say, has some sort of viral infection while she's pregnant, she might have CMV, she might have rubella, are these women at risk of having children who have mental retardation? The answer, of course, is yes. What if it has nothing to do with pre-birth, but after you're born, if you have the problem where maybe you had a fall, maybe you lost consciousness, maybe you got hit over the head with something, could you develop mental retardation? If you live in a building where the paint is made with lead, if you're sitting in some corner of a room eating paint chips, could that develop into mental retardation? Of course. If they didn't take care of you in a good way when you were young, could you develop mental retardation? Most definitely. So again, it's not only prenatal but postnatal that could be the cause of this disorder. Mental retardation will affect approximately 1% of the population. And of course, you see more in boys than in girls at an incidence of about 1.5 to 1. Now, there are various types of mental retardation. The first one is mild mental retardation, and these are the individuals that have an IQ anywhere between 50 and about 69 or 70. This is the largest group, so that 85% of them will be mildly retarded. Now, what's essential about them is that they do everything we do. They go to work, they handle their own affairs, they make decisions, and what they do achieve is approximately a 6th grade level of education. Now, because these are children who will eventually have problems in school, who will eventually have problems with learning, what happens eventually is that they have problems with their self-esteem. Their self-esteem leads to issues with impulsivity. Their self-esteem leads to issues with behavioral control. So you will see some associated conduct disorders, behavioral disturbances in these individuals who have mild mental retardation. So basically, they live alone, make their own decisions, and of course, they always have the capacity to make their own decisions. The second level is moderate retardation, and these are children who have IQs between 35 and 50. These reach approximately a 2nd grade level of education. So they probably would not live alone. They would not work alone, and if they do work, they work in what's called a supervised work setting, which is nothing more than a sheltered workshop. So they do need that added supervision to make sure that they're safe, make sure that they're doing the job correctly. And it is very unlikely, given that they need supervision at work, for them to be living alone. So you would expect them to live in some sort of group home or some type of residential facility. The third type of retardation would be the severely retarded, and those are the children who have IQs from 20 to 35. Now these need to be basically taught certain things, like they could brush their teeth, they could comb their hair, they could be taught basic living skills. You would not expect them to live on their own, and you would not expect them to be able to work. So they benefit from basic training. And the fourth type of mental retardation is the profoundly retarded. These are individuals who are under the IQ of 20. So what happens to them is that they need to be in a highly custodial environment. Everything has to be done for them. They're like babies where you have to provide all the assistance that you possibly can. And again, whenever they ask questions on mental retardation, what they probably focus on is the mildly retarded because they're the most common. Remember, 85% of them fall into that group. When you're about to do a physical exam on a child who has mental retardation, you're not going to find much of anything because remember, the majority of them are in the mild mentally retarded range. So they're not going to have any kind of abnormalities. However, if you were to examine a child who has Down syndrome, if you were to examine a child who has fetal alcohol syndrome, then of course that's a completely different story. But the majority of them have a normal physical exam. As far as diagnostic tests, the ones that are routinely done would be the amniocentesis, and these, of course, you will be discussing these in detail when you go over OBGYN, but what is essential about the amnio is that these are women usually over a certain age, typically 35. They could be high-risk women, they could be women with history of Down syndrome, and what the amnio will do is determine whether or not these children have this disorder. As far as the treatment of children with mental retardation, primary prevention is the main treatment. If you have a family who has a family history of Down syndrome or other kind of mental retardation, then genetic counseling might be the safest solution. Another type of treatment would be to make sure that the woman is safe, make sure that the woman is taken care of, make sure that the pregnant female is taking her vitamins and taking care of herself. You all know that women, when they're in their third trimester, is when they're at highest risk of being abused. So that is the things that you should avoid to make sure that that baby, when that baby is born without any kind of disorder. As far as the differential diagnoses for mental retardation, there's going to be many, whether it's children with learning disability, whether it's children who might be deaf, children who might be blind, children who are misperceived as having mental retardation, children who have autism, and you know that most of them have mental retardation, but I will be going over autism in another chapter. And of course, children who have some kind of environmental deprivation.